Okay. Welcome, everyone. Do you want to start us off, Jacinth, and share your story?
Sure. Thank you. I am so excited, first of all, to be actually co-teaching with Chelsea. She is such an amazing person, and she is an expert on this. But I just want to introduce myself. I'm actually Jacinth, and I'm actually the owner of Love Essential Life. And I just excited to actually be able to share this, my own experience with my own pregnancy and birth, and with my baby. Which she's not a baby no more, but anyway. And when I first got started, which actually the oils actually just had a miscarriage, and it prompted me to actually clean up things up a little bit more and then go with a more natural lifestyle. And the oils was right into my alley. And then it just kind of grew from there into removing toxin into my home, and then to be having more of a natural approach with my pregnancy. So I'm super excited to be able to co-teach with Chelsea here. And so Chelsea, she's actually the balanced natural mama, right? Did I say that right?
Naturally balanced mama.
Oh, always have it backwards. I'm so sorry. And anyway, she is really amazing, and she is actually a doula, and she is the expert on this subject, and she has created this beautiful slide and presentation for all of you guys. I'm only here to kind of share a little bit of my story, but I'm really excited for you guys to learn from Chelsea, and then to be able to reach out to her if you do have questions as well, and if you do need to have some doula services. So Chelsea, it's up to you now.
I'm just going to make sure that this is in our group. Technical difficulties. Okay. How do I get back here?
So for everyone in the group, welcome, welcome. And then Chelsea is going to be taking the stage here. I'm here as a co-teacher, and I'm super excited for our naturally balanced mama to actually talk about this beautiful subject that she's so passionate about. And here you go, Chelsea, you go right ahead.
Thank you. Yeah, welcome everyone who is maybe just catching it on Facebook. Like Jacinth said, this is my passion, and I have put my heart and soul into this presentation and everything that encompasses birth, pregnancy, postpartum, and beyond. Like there's so much to this stage of life, although it can be such a short stage of life for some moms, or it can be long if you have multiple children. So it's just such a beautiful time and stage in our lives. And I think we need to honor ourselves, our bodies, and everything that our bodies go through to create this life and to birth that life. So I'm a mom. I have 2 kids, but I have had 3 pregnancies, and it has been a journey so far. I have learned so much, and essential oils have been such a huge part of that. I was able to have both of my births while I was using all of my oils and a natural approach to my entire pregnancy, which I think is so awesome that I was able to do that. And now being able to speak from experience on the things that I have used and that were tried and true and worked for me, and that have been able to work for so many other women as well. So we can just jump in. There's a little disclaimer. So as we know, these statements have not been elevated by the FDA or by Health Canada. So grab a notebook if you don't have one yet, or if you are a busy mama with kids already at home, then just take some screenshots. Or if you're watching this as the recording, definitely go through taking screenshots. And if you registered for this class, and if you filled out the form to register, you clicked the pregnancy class, then you will get the recording as well. So you will be able to save this, look back on it. Maybe you're not pregnant yet, but you'll be able to have this to kind of look back on. And I will share some of the slides with you as well for some of the information, protocols, and recipes, and all of that. And this is a very small version of a much larger program that I will be offering for purchase as well, with a ton more information. As you can see, as we go through, this will just be the very basic version, and then the paid version will be a lot more in depth.
If I can just add there, you're definitely going to want to purchase this program because there is so much goodness and little nuggets that you will get from this. And Chelsea is really thorough onto making sure that you have everything that you need so that you can have a natural birth, and then it can help you postpartum and then with your baby as well. So,
do you want to talk about essential oil safety?
Yes, I sure can. So essential oils, there sometimes there's a little bit of discrepancy, especially around like pregnancy and all that. But you have to rest assured that with doTERRA, it's extremely safe, and it will it will not harm your baby. You definitely do want to contact your doctor before usage, but you have to look at the warnings and all that. And I'm just going to read this here, but I can't speak for all oils. However, yes, the essential oils of doTERRA is definitely safe during our pregnancy. So you just want to make sure and take note that not all of the oils are safe. And so you want to do your research, and then the certified tested pure essential oils from doTERRA are 100% pure, and they're naturally extracted from plants. So there's no fillers, there's no chemicals, artificial ingredients, or pesticides or anything like that, and that would dilute their natural qualities. And they're free from like any type of contaminants, or pesticides, herbicides, any other chemical residues. And so they're truly they far exceed the FDA minimum standards for purity, and it's beyond organic standard, which is extremely important in the fact that doTERRA does, I believe it's 64 different testing on every single batch of essential oils. So, and you can actually go to source2u.com to get some more information about this.
Mm-hmm. Yeah, and the purity is like one of the most important things when we're trying to keep our bodies healthy and function at an optimal level, especially when we're growing a baby. So we want to make sure we really know what's inside the bottles that we're using. That is a important one. Yeah. And just touch on the dilution chart. And I just threw this in here just so that you have it going through any of the recipes that we're going to talk about. It's just here, you have it when your baby's born, or if your baby's already born, then this is kind of a good reference on what you need to add oils to carrier oil ratio. So you can see under 1, you want to go on a very minimal. And a lot of seniors will kind of be around little kids' ages as well. And then you can see as the ages go up, they can get kind of more oil ratio to the amount of carrier oil.
If I can just stop, just a little brief with the whole, with elderly people, there's this saying about once a man, twice a child, right? So that makes sense with using more of children, or more diluted version for the elderly. So I know it's a little bit it makes sense what you said there.
And then I want to just chat about prenatal care. This is something we really want to add in before we're pregnant, but it is something if you're looking for a natural supplement or a prenatal vitamin and you're taking one and it's just not sitting with you well, sometimes we can have reactions to vitamins that are full of fillers. I know I personally have, not when I was pregnant because I was taking these, but before that. So I really want to just make sure that you know what's in your prenatal vitamins, because that is super important to know how we're nourishing our babies and our bodies through this. So these are the supplements that I took. And we didn't get into each one, but I know just saying you took these as well. Do you want to share a little bit about your experience?
Yeah, so I definitely wanted to make a big switch because like my first pregnancy, which I had a miscarriage, I was actually using different kind of supplements, and I just felt like it was extremely important for me to go with more bioavailable supplements, and that my body would recognize. So the lifelong vitality was actually exceeding the prenatal expectation that I had in my vitamins. So I really love to have those as a substitute to the other over-the-counter vitamins that I was using in my very first pregnancy.
Hmm. And these were something that I personally was already taking. So a lot of women, if you're already taking vitamins before and then you find out you're pregnant, that's kind of when you're like, oh, I better switch to a prenatal. But it's just like, it's awesome to know that the vitamin you're taking before can be the same one that you're taking, and then your body's not having to adjust to it.
Mhm.
Um, I know for me personally, my body didn't adjust well to taking different supplements. So finding really good quality sourced supplements that had incredible ingredients in them, and like Jacinth said, that were bioavailable, my body knew what to do with those ingredients. That is what helped kind of sustain my body and through my pregnancy. And then postpartum, these were like hands down the only thing that I needed to take. It kept my body functioning well with the lack of sleep that I was getting, kept my immune system strong because I don't know about you guys, but anytime I get lack of sleep, my immune system just kind of gets run down, and then I get any type of little cold or flu that's going around. And then big piece of it for my postpartum was my mood. These helped pull me out of a funk during my first pregnancy and postpartum with my son, and I swear by these. I did
Mhm.
before, but even more now after having him. And like we have said, your body can recognize these just like it is food. And that is the most important piece of this, having these really, really good vitamins that your body can recognize. So when your body cannot recognize vitamins, it doesn't know what to do with them. And then it ends up either being harmful for you. So my personal experience on taking really cheap vitamins, I was super sick and throwing up from them. And when you're pregnant, this is not something you want to be doing if the first trimester is already going a little bit rough. So knowing what is in your vitamins is super, super important. And then a question that gets asked is that there is some concern about the amount of vitamin A. So then in these vitamins, it is a natural form of vitamin A, beta carotene, and your body will actually absorb it on the amount that it needs. So you will never overdose or you will never get too little. Your body will know how much you need. And then just like a lot of our other bioavailable vitamins, it just pees out the rest, or you excrete it somehow out of your body. And then there's just a little bit of a resource. So just feel free to take any screenshots along the way if you're like, yes, I would like to look up the research on that. And definitely ask questions. If you're watching the recording and you are like, I'm not sure about these, I'm kind of skeptical, please reach out because these were my lifesaver. And then to kind of extend the prenatal care, um, these supplements are hands down the most incredible supplements. I still take these to this day and took them all throughout my pregnancy. So the only additional thing you want to take with these lifelong vitality vitamins is some kind of methylfolate or folate. You don't want to take a folic acid supplement because that's actually a synthetic version. So you want to find some type of methylfolate or folate. And you want to be adding in, I think it's around 1,000 milligrams, but again, talk to your midwife OB on what the recommended amount that a pregnant woman should be taking. And you want to be starting the methylfolate like 3 months before you even get pregnant, so that all
Mhm.
of the like the tubes and all of like the development of your baby, that can all be kind of helped and got really good start when your baby actually implants in the uterus.
Yeah.
And
Or
then,
if
yeah,
you're, oh, sorry, or if it's a surprise, as soon as you know, go
yeah,
take get them.
yeah, yeah, for sure. Yeah, my second, was not on the ball. I did not take those ahead of time. So it's like, oh, I'm pregnant. Now I have to start taking these. But we'll chat
Life
about these
happens.
supplements. So the probiotic, which is the PB Assist Plus, is one of the most incredible probiotic supplements I have ever seen. And I have researched a lot of probiotics before I found doTERRA. So there's actually a prebiotic and a probiotic within the same capsule. I should have put a picture in here because I just think they are the coolest vitamins. So they have 6 billion active probiotics within the probiotic supplement. And then there are so many different strains in the prebiotic. So the prebiotic will break down in the stomach where it needs to. And then the probiotic will break down in the intestines where it needs to. So it's all timed release and it gets to where it needs to go. And it can really help your digestive system and immune system and help give you that really good gut health, because that is ultimately where our immune system stems from.
Mhm.
And then did you want to add on to that probiotic? Just saying.
Yes, actually, I actually really love to have that on hand, especially when you have to go when you're a little bit more at the end of your pregnancy. You have to take that Group B test, right? And I was like, I did not want to get positive in I because I did not want to have any extra antibiotics to put into my body as I'm delivering a baby. So I was very proactive. I actually start taking the probiotics. I think it was like maybe a month prior to have that test. And then it turned out to be negative. So I'm going by that it actually really helped, because then it was actually good bacteria that was in my gut, and not the extra excess of that Group B bacteria that would require to have antibiotics while delivering.
Yeah. Yeah, because if you tested positive, they will automatically, if you're delivering in a hospital, they will automatically start you on an antibiotic. And that's ultimately going into your body and then into your breast milk. So now your baby's getting an antibiotic when they don't necessarily need an antibiotic. So it's just an overuse of antibiotics. So if we can add a probiotic, and then if you had to have an antibiotic, definitely get yourself on a probiotic and make sure that your baby's getting enough, either whether it's through your breast milk, and if you're doing formula, then give them a probiotic as well, so that they can make sure that they're getting the proper amount as well. And then just a little bit more on the extra folate. So we know that it does not require it because they're not a prenatal vitamin. So that's where we just say, just add a little bit of extra. And I get mine from Well, but you can purchase them from Amazon. The picture was just the ones that I take, but any good natural supplement, like I said, if it's a folate supplement, will be just fine. Again, talk to your OB, doctor, midwife, whoever your care provider is, and they can give you some more information. Or a naturopath. If you're like, I want to go the holistic route, then definitely see a naturopath. And then the Terrazymes. So if you don't know a bit about my original story, digestive issues were a major concern for me, and it's kind of why I got started into this whole natural health journey in the first place. So ultimately, when I became pregnant, digestion was a big issue for me because it was pre-pregnancy. So taking the Terrazymes allowed them to break my food down in my stomach faster, which then allowed my system and elimination system to work better. Especially when you're pregnant, everything is getting compressed. Your digestive system is being squished now, and your stomach and all the things are not functioning the way that they normally would. And pregnancy cravings is a real thing. And I was craving all the foods that my body did not like or did not agree with. So the Terrazymes was really helpful for me to be able to help that. Like, if I did have bread, then I could take a Terrazyme and then it would kind of help digest it better. So that was, again, I still take these to this day, but that was super helpful with pregnant. And then within postpartum, We know going to the bathroom is not as easy after you've had a baby, so Terrazymes are super important to take to help that process so that you can have a bowel movement and not be in pain. And then we'll just chat a little bit about a few nutrition supplements that doTERRA has. So again, this can be pre, post, and during your pregnancy. So the greens, most of us, especially when we're pregnant, we don't actually get the proper amount of greens that we need. I don't even know the recommended amount. Just saying, do you know how many greens we should be getting? It's like 6.
Not during pregnant. I know just on a normal day, you should be at least getting 2 cups of greens.
2 cups, okay.
2 cups of green on a normal day. So pregnancy, I would say double that up.
Yeah.
Right? Because that's where you would get your folate as well, right? In the greens.
Yeah, and all your iron and all that.
Yeah.
So this is an awesome supplement, and we know that doTERRA only produces the best quality, and they didn't release these supplements for a long time because of that. They wanted to have super sustainable sources and really good quality in their products before they release them. So as we know, taking a green supplement will help support our immune system, digestive health, and it provides our body with so many nutrients that we're not getting from the foods. If we're not eating green foods and kale and spinach and all of those good nutrition, then this is kind of can step in and help. It's not going to replace it, but on the days that we're like, I didn't eat as good, this is a really good option. If you're just like, I didn't eat as much as I wanted to, then you can just add this into a smoothie is the best way, or into a glass of water. It honestly tastes delicious. And I've tried a lot of green supplements and they do not taste delicious.
I have to say, like with these greens, like because doTERRA, they did have greens before, but they reformulated, and it was, I still like the previous, but it was very grainy, and this one is not grainy at all. It's actually like an improved version, and it's so much better. And yes, like especially like during and if especially if you have multiple kids and you need to get your nutrients and you're pregnant, and then even afterwards when you don't have a whole lot of time, these are like perfect to have, right? To like just get that extra greens into your system.
Yeah. And smoothies are such an easy way. And that's why I put in there that my kids love it too. They don't even know there's greens in their smoothie. Like I will add spinach, kale, and green powder in their smoothie, and they don't even taste it. So it's a really awesome way to get nutrition into your body, into your baby if you're pregnant, and into your kids if you already have toddlers at home. And then the fiber. As we know, most adults, speaking outside of pregnancy or motherhood, do not get the recommended fiber. So having a fiber supplement is really awesome. Again, can be added to oatmeal smoothie or just water. Fiber is delicious. It has a lot of apple skins in it, and it tastes wonderful. So you can help maintain your microbiome and like a healthy microbiome, because that's ultimately how we get a good, strong gut. And then it really helps our digestive. We know fiber is really good for helping us go to the bathroom. So this can be another supplement if constipation is kind of something that's coming up for you. And then it helps with our metabolic system and processing everything, working it through our body. So this is a really important supplement as well. And then last one on the nutrition side is the protein. So as we know, we don't necessarily get as much protein as we should either. And then finding a really good source of protein powder, I find is tricky, and finding one that's actually delicious. That has been my struggle. So I am so grateful that doTERRA has released these, because again, I know they are coming from very, very good sources. And the cool thing is there's no sugar in them. They're sweetened with monk fruit and stevia. So those are actually sugars that your body knows how to accept, and it does not have blood sugar spikes. So anyone who's diabetic, or if you have gestational diabetes, having these kind of sweeteners are not going to affect your blood sugar.
I really love to add the protein powder, into like baking, especially for the young kids. If they don't like to eat like the protein or whatever, you can just kind of sneak in some protein here and there, right? So in pancakes or muffins or cookies, and it's just like an extra little, haha, I got you.
Yeah. Yeah, we make a lot of protein balls and my kids absolutely love them. And it's an awesome snack that you could make and put in your freezer for when baby is born and you don't have as much time to make healthy snacks and you want some good nutritious stuff on the go, or it's like, I'm sitting down to breastfeed, I need something to eat. You can grab it quick out of the fridge. So it comes in vanilla chocolate and there's a vegan one as well. So we'll just chat about the first trimester. So again, the prenatal care, taking those LLV, taking the PB assist, Terrazyme, and then extra folate, and then optional. We didn't touch on it yet, but the bone nutrient essential complex is a part of the women's kit that doTERRA has. So they are a supplement that helps increase the nutrients and it fuels your bone health. So as we know, as we're creating humans, we're also creating their skeletal structure. So bone health is very important for us because our body is taking a lot of stuff out of ours to give to baby. So it's like we have to make sure we're constantly replenishing our vitamins, nutrients, all of that, because our body just gives everything it needs to that baby when it is growing. And then fiber, greens, and protein can be something you can add in that are optional. And then we're just going to touch on a few of these, but morning sickness, fatigue, breast tenderness, head tension, mild acne, and heartburn. So morning sickness, one thing that worked really well for a lot of women, I didn't get a ton of morning sickness, but the ginger drops are really awesome, even outside of pregnancy, just to kind of calm an upset stomach. And then again, take as needed. There's no sugar in those as well. So it's a nice, safe, they're like a throat drop, Halls, whatever you want to call them. And then peppermint is one that I swear by anytime I have any kind of upset stomach issue or digestive issue. And you can actually put it directly on the tongue, on the back of the neck, or on the chest for instant relief. And then ginger, again, you can take it internally in a veggie cap or in warm water as like a tea, not boiling water, but just warm. And then you can make it as a roller ball and apply it to the belly. And then Digest-Zen or Zengest can also be taken internally when you start to feel that morning sickness. And then you can rub it on the stomach, apply it to the chest, or take the digestive tabs or soft gels. And then if you just want to chat quick about the heartburn protocol that you used.
Yeah, so for myself, I actually had a lot of heartburn and acid reflux when I was pregnant. So I love to have the Digest-Zen Touch. It's already pre-diluted, very safe for pregnancy and even for like babies and all that. So I actually was applying it directly on my sternum. It was really helpful. And also, instead of taking Tums, because Tums, if you have read the ingredients on Tums, it's actually full of aluminum. You do not want to take that. So doTERRA does have the Digest tabs, and so it really was helpful as well to help with the acid reflux and the heartburn and all that. So really highly recommended.
Yeah. And then breast tenderness, this is one because your body has started creating colostrum so early, and your breasts start to grow as your baby is growing, and fill with the tissues and everything that's needing to happen to prepare them to produce milk and everything else. So you can massage with lavender or aroma touch. And then hormonal headaches. This can be one as, again, your body's shifting, all those hormones are changing. You can apply deep blue, frankincense, past tense, lavender. So again, you'd want to apply like kind of away from the eyes. So we do like temples. You could roll it on the hairline. You could do the back of the neck, shoulders, and any area that you're feeling. So if it's maybe like the back of the head that you're feeling the headache, then definitely do that. And then we also recommend taking the bone nutrient complex, which can help kind of like settle out the hormone imbalance, or just if there's a spike in the hormone before it kind of like settles down. And then on to the second trimester. So again, same prenatal care here. And we'll just chat quick about some of these. Stuff for stretch marks, digestive discomfort, respiratory discomfort, aches and discomfort, urinary support, and immune support. So stretch marks, the best thing that I found was Immortelle is awesome. That is our anti-aging blend, so that can be used on the face. I roll it on my belly as well. Yarrow Palm, which is a relatively newer oil to us, but it is incredible for our skin. And then I also use the Virage Hydrating Serum, which actually has Immortelle in it. And then I would just use the unscented hand lotion to kind of rub that in. And then you could also do lavender, frankincense are also great to massage on the belly. And then just saying, I think you used a different protocol as well.
Yeah, so for myself, like just for prevention, as your belly is growing, like so what I did is I actually was rolling the Immortelle all over like my belly, and then I also was adding the body butter, because when I was pregnant, the Yarrow Palm was not launched yet with doTERRA, or I would have used that. But the body butter, it's in the spa section. It's actually really amazing. It's very rich, got shea butter in there. It was just nice and rich, just to keep my belly nice and moist. And I was, or moisturized, not moist, but moisturized. And it was just really amazing, just to keep like from the skin to just overstretch and all that. So.
Mm-hmm. Yeah, and I was the same way, very lucky, and I did not get any stretch marks with either pregnancy. So it's
and
the
drinking lots
oils
of
or
water,
the skin, or a bit of both. Lots of water too. Like I think you mentioned that, keep your skin hydrated. And that goes for every part of your skin, right? There's so much in your body that is stretching and growing. So it's just like hydrate yourself, and that will definitely help with so many things, not just stretch marks in your skin health, but like digestive, immune, like there's just so much to it. But for any kind of digestive discomfort, like we said earlier, Digestin, the supplements, that was hands down the best thing. And then you can also try fennel, peppermint, lemon, and you just massage it right onto the belly. And I think it's like going a clockwise direction, because that's the way your body starts to kind of process and digest through the
the way the intestine goes. Yeah. And then follow the peristalsis.
Yes. And then respiratory discomfort, breathe, or it is also called Easy Air in Canada, or in the States, they also have a breathe vapor stick. So it's just like a big lip chap tube, which is awesome for chest, similar to Vicks, but obviously doesn't have the petroleum and the harmful stuff in it. And then you can also put a drop of lemon or eucalyptus on the tips of your middle finger or finger and walk them up and out of the nose of the cheekbone. So you're just kind of giving yourself a gentle massage. And like I've even tried peppermint right over the nose if it is something you're feeling that's in the nose. If it's respiratory and you feel it's in the lungs, then definitely apply it to the area that you need. And then immune support, On Guard, of course, that is our immune blend. And then, or the soft gels, Stronger, which is the kids' immune roller. So that's a more gentler version if you're kind of sensitive. And then third trimester, so same protocol, eating lots of nutritious foods and drinking lots of water, because you want to prepare yourself for birth. So it's like as you're coming into those last few weeks, you definitely want to be doing this, because it's like you're not sure how long labor can be. So it's like really prepare your body, give it all of the nutrition and all of the water it needs. Do this throughout, but it's like your main focus is definitely right before you're going to give birth. And then a few things we'll talk about: sleep support, growing discomfort, leg discomfort, group B support, hemorrhoids, anxious feelings, and swelling. On sleep support, Serenity, which is a restful blend, is incredible to get that sleep and the restful sleep that you need for your growing baby and your growing body. And there's also capsules, which is super awesome and can be taken. I like to do half an hour before I sleep, and then it gives it time to kind of get in your system and get your body relaxed and calm to have a restful sleep. Adaptive and the soft gels are another really good one. You can put the oil in the diffuser, take the soft gels. Vetiver is awesome. That is one of our like top oils for sleep. Cedarwood, lavender, Roman chamomile. So these are all going to bring that sense of relaxation and peace, and to the mind as well. Like sometimes that's the most important one. If we have a lot going on in the mind, as you're smelling these oils, make it a ritual. If sleep is something you're needing a lot of support on, make it a ritual where you're putting the oils in your hands and breathing them in and releasing any worries, doubts, fears out of your mind. And then growing discomfort, frankincense, lemongrass, aroma touch, copaiba, or the copaiba soft gels, lavender or deep blue. So any of these oils can be applied along your sides, back, or the area of need. So if you're feeling any pain through like the belly area or the back, as your belly and baby are growing, sometimes you feel it in the legs, then you can apply any of these oils here. Deep blue is kind of always like our first go-to one. And then as we go into leg discomfort, Aroma Touch, which is our massage blend, or Cypress are really good ones to help with circulation and everything kind of going on. So if even if you're getting some swelling in the legs, Cypress and Aroma Touch can be used together or separate, and just be given a nice massage, making sure to keep the feet elevated. And then Deep Blue is another excellent one as well.
Sorry, I use the Cypress quite a bit actually myself. My legs really swelled up like at the end there. Going into August, it was starting to get pretty hot out there. And I was very, very grateful that I had that oil, and I was putting my feet up as well. But yeah, like definitely like put the oil on and just kind of like releasing the pressure on elevate. I can't say the word. Put your feet up. Thank you.
And then another good supplement to take, as we've talked about this in the past slide, is the bone nutrient complex. And then the group B support. So this is one, if you did test positive for the group B, this is a way that you can kind of help treat that. So you could do lemon, oregano, tea tree on guard. So you would place 4 drops in a veggie cap and take those 3 times a day for 1 week. So that would be a protocol if you did test positive, to kind of help get your, I guess it would be bacterial, back to a normal level, so that test would be negative. And then labor and birth. So again, prenatal care is the same. And just again, supporting the body in the best way you can before your baby is going to arrive. Because again, sometimes we don't know how long labor can be, and we want to make sure our body has enough stamina and energy to get through the birth. So some of the stuff we'll talk about is preterm labor, breech baby, stalled labor, episiotomy, calm and focus, energy during labor, and immune support. So then preterm labor, you want to mix 3 drops of lavender or Serenity in a carrier oil and massage into the legs, starting from the ankles and moving up towards the heart. And you can also do the belly. And then contractions, clary sage, myrrh, geranium, and lavender. So you want to blend them together and make a topical mixture and apply the myrrh and clary sage topically as well. Like, it's whatever you have. You can use them all together or you can use them separate. And then some really good points. Once contractions have started, essential oils will not generally get your contractions started. There's some other natural options for that if you're wanting to kind of kickstart things. But once contractions have started naturally, then some spots that you can use. I applied clary sage, but you can apply a mixture of the two. On the inside of the ankle bone, the pinky toe and the lower abdomen is some great spots. And those are kind of your pressure points on where that's going to like target the body to kind of get contractions moving along a little bit more. And then breech baby. So you can mix 5 drops of myrrh, peppermint to 1 tablespoon carrier oil. You want to massage from hip to hip in a rainbow. So it's like you're getting baby to kind of move in that rainbow motion, and then end with visualizing that your baby is head down. That is like another key thing, because it's like subconsciously you're telling your baby, we need to be head down in order to have a natural birth, right? And then there's also some yoga poses too. And
yeah, I put my head upside down.
yeah,
I was on the couch and I went down.
yeah, there's lots of stuff that I learned in prenatal yoga for like inversions and everything else. And you can use this same type of like protocol for a posterior baby. That's a little bit hard to determine whether your baby is face up or face down. If they're head down, that's easy to tell. But if you're feeling, or your midwife can feel, or your OB, that they're feeling at your face or a bum up by your ribs, then generally that will determine whether your baby is anterior or posterior. Will affect the way that your baby is born and how it puts pressure on certain areas of your body. And then calm and focus. So we want to use really calming and grounding oils. So balance is like the top oil that you want to be using. And then mixing it with wild orange is like an incredible combination. And I will actually put that in my diffuser all the time, just because it's so grounding, but yet uplifting. So it's an awesome combination. And then you can also use Serenity as well. And you can just diffuse it or open the bottles and smell them like that. Or if you're in a hospital and they don't allow diffusing, then just apply it to a cloth and just kind of hold it over your nose that way. And then energy, if you're kind of feeling like you're getting to the end of that point of labor and you're telling yourself, oh, I just can't do it anymore. Peppermint is a really good one to kind of get things kickstarted again, give you a little bit of an energy boost. And you can also use Cheer, Wild Orange, or Elevation, which is not available anymore.
Yeah, they diluted it. Yeah, Elevation is unfortunately, because it was one of the oils in there was not sustainable anymore. It's not for purchase ananymore, which is unfortunate.
I love that oil.
Yeah, I gotta say something about like my little story about my birth, because it was so I wanted to have a home birth, but because there was already the meconium that was already released, so we had to go to the hospital. And so I was not able to have a diffuser in the hospital, but I was able to have the FOP. And I have to tell you, peppermint and wild orange for myself was a godsend, because I'm one of those people that unfortunately I had a lot of vomiting, because my sense of smell was so developed while I was pregnant, and especially during delivery, that anything was not, and I could not even handle my own smell. If you can, sorry about too much information, but it was very important for me to, we're all like women probably watching this anyway, so we can all understand each other. So yeah, so it was so beneficial. And another thing about peppermint, you can actually, if you have the peppermint beetlet, ask everybody in the room that is in the labor to please put a peppermint beetlet in their mouth so they have a fresh breath. Okay, everybody needs to have fresh breath for the lady in labor.
Yeah, it's a good tip. I actually include those in my doula package, so that's an extra
Awesome.
tip that I could add in as an extra use for them. So immune support, again, we know our bodies go through so much during labor, whether you have a C-section, a natural birth in a hospital, or home birth, there is just so much that your body goes through in that process. So supporting our immune system needs to be super important. Again, like I said earlier, we don't get the proper sleep that our body needs, as we now have a tiny human that is needing our attention. So diffusing on guard, that will not only help you, it's going to help your baby, making sure it's obviously in a well ventilated room and you're not putting 10 drops in a diffuser, because that's a little bit excessive. But anytime if you're worried about diffusing around your baby, just start with 1 to 2 drops if the diffuser's like right beside you. But generally, if you're in a big room, it's not going to affect your baby at all. And like even supporting in the hospital. So it's like if you can have a diffuser in your birthing space, or again, putting it on the cloth, you could have the roller ball and apply it to your spine. And then any kind of massage at this point during birth is going to be super supportive. If you're a mama that is like, do not touch me during labor, make sure your support team knows this so that they don't try to come in and kind of help. I just had a client recently, I was going over her birth story with her, and that's what she had said, is she was not okay with anyone touching her. So it's like, as long as her birth team knew that, then they knew that that was not something she was wanting. But there are a lot of women who want some kind of pressure on the back, especially if you're having a lot of back labor, or any kind of like shoulder, feet, legs, any kind of that. Especially if you have a doula, this can be something that they are doing for you, which is really cool. So make sure you kind of add this into your like birth team or support.
And if you do know, like for myself, like I have to say, like I did not know that, because I was bringing up so much, that poor little nurse, she wanted to comfort me, but her hands were so nice and warm that it was like making me like go even more. So I had to, like, I was not very nice. I kind of snapped a little bit at her. It's like, don't touch me. Because like it was just making me bring up even more, and it felt so bad. So yeah, so forgive yourself if like sometimes that happens. Sure, everybody will understand.
Yes, especially if your husband or your partner is your support person. Just remember that they don't necessarily know exactly what they're doing either. They're just kind of going by either what you talked about while you were pregnant, or what they maybe learned in a childbirth education class. So yeah, just be as kind as possible, but also don't apologize. You're going through a lot to deliver a baby. So yeah. Again, in your postnatal care, you want to be continuing your supplements, taking all the same things that you were taking during your pregnancy. And then again, you want to eat those really nourishing foods, because now you're supporting yourself, the production of your breast milk if you breastfeed, and then those nutrients are going to your baby as well. So that's another super important thing you want to think about. And then different things we're going to chat about, or some of the things we're going to chat about: afterbirth bleeding, afterbirth discomfort, cramping, abdominal support, lactation, hemorrhoid support, nipple discomfort, engorgement, and emotional support. So afterbirth bleeding, some really good oils for that is clary sage, helichrysum, ylang ylang, and these all help tone the uterus. You can also place the oils on the ankle and those reflex points that we chatted about during labor and birth. And then also for afterbirth discomfort, lavender, frankincense, you can mix it with witch hazel and aloe, and you can put it on an organic menstrual pad. You want to get like the postpartum ones, which are a lot bigger than normal, and then you can freeze them.
Yeah, they're awesome.
Yeah, and this is where you're going to get that soothing support, especially if you've had some tearing during your labor and birth. It's very healing, especially with those essential oils in there as well. And then it's going to help take some of that inflammation down. Because as we know, there's a lot of inflammation that happens during birth as everything is shifting and baby is emerging. And
Yeah.
then cramping and abdominal support, deep blue oil or rub. So again, be mindful if you're doing a lot of skin to skin. You want to be mindful if you just apply deep blue to your belly or anywhere baby is going to touch with their skin. Just place a blanket over your belly or something. I had receiving blankets around me constantly. So I would just make sure to protect baby because that could make their skin really hot and irritated if you literally just applied it and then they're now on you skin to skin. And then Clary Calm is another good one. And the Copaiba soft gels and the deep blue polyphenol complex is another good one. That's just lots of different options. Lots of things work for some people, some don't work great for others. So you just have to kind of trial it out. That's usually what happens with natural options. And then hemorrhoid support. So I had that as a part of one of the other recipes. I will get that to you if anybody wants that. Because I had made a spray, which was really helpful for me in the.
That'll be part of your purchase package, right?
Yeah. Yeah, the spray was really helpful because I had a ridiculous amount of hemorrhoids. My body was not used to sitting that much for the amount I needed to breastfeed. So supporting my body that way after every time I went to the bathroom was an incredible way to help those hemorrhoids for the amount of sitting that my body was not used to doing. And just pressure and your body releasing all the hormones and different things that is changing. And then baby blues, you can use Melissa. That is an incredibly powerful oil. Just one drop on the back of the neck can kind of help affect the body in the way that it wants to kind of help lessen those anxious, sad, emotional feelings. And then frankincense, adaptive, the soft gels, and the Copaiba soft gels, Serenity soft gels, making sure you're getting good sleep is super important. And then any of the doTERRA emotional aromatherapy line.
For the Melissa, I like to you can actually just, that's what something I was doing is that I just swipe my hand, like my thumb, all just over top of the bottle, like the cap, not taking a full drop, and just put it on the roof of my mouth. And that's another great way as well to kind of support yourself, like emotionally and all that.
Yeah, and then I just have a recipe here. So if you want to take a screenshot of it for the postpartum padsicles, and you'd be able to make these yourself. There's just the ingredients, and then again, making sure you get the organic pads because we are putting these on very sensitive areas of our body, and we want to make sure there's no extra harmful chemicals being put into our body. Yeah, these were super helpful.
Let's just say it, our vaginas are precious.
Yes, very, especially at this point if you just had a baby. And then the newborn stage, this is one of my favorite stages. So again, you want to make sure that you're supporting your body, especially if you're breastfeeding, because all of your nutrients and all of your goodness that you're putting into your body is ultimately going into your breast milk, which is helping baby. Because when they're that little, they are not taking their own supplements at that point. So that's our job to make sure that they're getting really, really good stuff. And then I continued taking my folate after because it just kind of helped with the mood and all of that stuff and helping with everything that your body's going through and changing. And again, you're still giving nutrition and nutrients to your baby, which is ultimately feeding all of their brain development and everything that they need to develop and grow. So some things we will talk about: supporting trauma, protection and bonding, umbilical cord support, tummy troubles, jaundice, diaper rash, teething, and congestion. So trauma, so if you had a traumatic birth or something happened during pregnancy or whatever it is for you, if something is feeling traumatic, again, Melissa is your oil that is going to be very supportive for you and baby. Because remember, if our birth is traumatic for us, it is also traumatic for baby, especially if we have had any kind of support, medication, whatever it looks like, where we needed to ramp up the contractions, that can be really challenging for baby. But again, they can't express that to us because they can't speak. So having Melissa on yourself and then applied either diluted or undiluted to the bottoms of your baby's feet, just like Jasaint said, swipe over the top of the bottle, and you can swipe up baby's feet and then do the same thing for yourself on your feet, back the neck, wherever you're feeling. And that just really helps kind of release those traumatic emotions and feelings, so we're not holding it in our bodies, because when we do hold stuff, it can kind of sit in and be and like turn into tension in our bodies. And for any mamas who have breastfed, you already get enough tension in your shoulders that we don't need to add any more. Jaundice, so you could add 1 drop of geranium, lemon, or rosemary to baby's feet every diaper change to help support the liver in breaking down the bilirubin, and indirect sunlight also helps. So you could be doing this with that, and it's going to be helping with the jaundice. Diaper rash, figure out what the root cause is first. Did you just change your laundry? Just really figure out what could be the first thing. Did you eat something different? I know a lot of moms will eat, someone will make them a lasagna or whatever, and it's not a food that they normally eat. And just the high acid levels in the tomato sauce can throw off your body, your digestive system, and then it can throw off like your baby's system because they're getting the stuff through the milk. So a good oils to use, sandalwood, myrrh, applied with fractionated coconut oil. And then you could also use immortelle, lavender, helichrysum, or tea tree with fractionated coconut oil as well. You can either make it in a spray or just apply them to the hand with some coconut oil and then rub it on baby's bum. Congestion, so you want to add a few drops of breathe and frankincense to the diffuser near the baby. You don't want it like directly beside, but within the room. And then we also found the nose Frida was very helpful to get. It's gross, you have to like suck the boogers out with your mouth, but those other hand ones just never worked for us. So
I feel the same too. It was like that for us too. Like I love the one you have to suck it, but it just like you need that extra suction to like really get that stuff out. And then for the diaper rash as well, like for myself, like it was not like I realized that Lily Rose was actually sensitive to chlorine. So that's my daughter, Lily Rose. And so that's something that I figured out. And it was right from the hospital when she had her first bath. And then because I already was using the On Guard detergent, so I knew that things were clean for her laundry and all that. And it was like when she took her bath, I was like, why is she so blotchy? It's like, oh, sometimes it's just, the laundry that you're using or the soap you're using. And like, no, it's all I use is all natural stuff, right? So then I just realized that because the city using chlorinated water for their water system, so that's what it was. So, but also for the diaper rash, doTERRA does have, I'm not sure if you did mention it, but they do have that nice diaper cream as well.
Yeah, no, and I love that one. For anybody doing disposable diapers, it's not super safe for cloth diapers. If you put a liner in your cloth diaper, then it would be fine. But just because there's zinc in it, and that can clog a cloth diaper. But if you're using disposables, then it's an incredible cream, and I use it all the time if the boys randomly have a bum issue to this day. And then breastfeeding support. Again, keeping up with the same care routine for you and supporting yourself, and drinking so much water. Like that is key in creating breast milk. So ones that we'll talk about are breast tenderness, nipple discomfort, engorgement, lactation, increasing milk, and decreasing milk supply. So breast tenderness, applying lavender directly to the nipple after breastfeeding. And Jasaint and I were just talking about this. You can wipe it off, you can leave it on, If you're finding babies kind of deterred from the nipple, then definitely just like wiping off the nipple, because the scent just might be too strong, like having the lavender right there. And then nipple discomfort, mixing 4 drops of any of these oils, geranium, myrrh, sandalwood, or lavender, to 1 teaspoon carrier oil. So carrier oil is fractionated coconut oil. It can be almond oil, olive oil if you want, kind of whatever you have in your home. If you don't have any, or just solid coconut oil can work as well. And then do this right after nursing, so you don't need to wipe it off. But again, if you're feeling you would prefer to wipe it off, then do that before you need to nurse. Or if you nurse from both sides, I know Jacinth was saying this, then if you're both sides on one feed, then you want to make sure you wipe your nipples off if that's going to make you feel more comfortable. And Correct-X. So this is kind of our ointment for any kind of cuts, scrapes, that kind of thing. So a super tender nipple that needs some support, this can be really, really calming to any issues that are coming up, for sure.
I have to say, like, sorry, I just like to have, like, it was a godsend for me, because like definitely, like, I had so much trouble, and I wanted to breastfeed, and everybody has to make their own choices what they want to do. But I tried the antibiotics cream. I tried all those other cream that you're supposed to have, whatever, that's over the counter, and it did not work. It was actually the Correct-X and the myrrh that actually helped heal my nipples, and then make it possible for me to continue to breastfeed my daughter.
Mm-hmm. Yeah, and again, you have to find what works for you. There are so many different options out there, but as you read on the bottom, I highly recommend hiring a lactation consultant. We are not pros at knowing how the proper latch should be, because that can really affect the length you breastfeed for. If your baby never got a perfect latch in the beginning, then it's hurting you, and breastfeeding, as you progress through the journey, it should not hurt. So hire a lactation consultant, and I will have one linked up at the end who I highly recommend. Because like, I feel a lot of women stop breastfeeding because there's pain or there's discomfort, or the nipples just never get a chance to heal because baby's not latching properly. And that's not the way it should be. So hiring someone that can really help and knows this stuff. I am not a lactation consultant. I have tips and tricks, but I have not studied it like the person that I'm going to recommend has. So some tips for engorgement. So you can add 2 drops of lavender, geranium to 1 cup of hot water. And you want to soak a washcloth in the solution, wring it out, and apply it to the breast. You can also get, I forget the company, but anyway, so they're like little rice or beans. I'm not sure what they're made of, but you can warm them up, and then you can apply that. And I would just tuck them into my nursing bra if this ever happened, or I just had like kind of sore nipples when my milk started to come in and stuff like that. But by all means, if you already have a washcloth, then this is a super easy solution that you can try. And then gently expressing by hand. So you can use a breast pump, but again, the more you pump off, the more your body will create. So just hand expressing a little bit. You can do this in a hot shower, will help your body know that it's like, I don't need to go create a bunch more milk if you just pumped a bunch off. But again, if baby's able to nurse, that is like the easiest way to kind of help with engorgement, because it's like, get more milk into my baby. But if they're sleeping, then this is definitely something you can try. Or when they start sleeping through the night, sometimes this can come up as well. And then yeah, we chatted about breast lactation consultant. And then just some of my common kits that I recommend. So my Birth and Beyond kit is the one that I recommend for all of my doula clients. This is just a very basic kit to give you some of the essentials that you'll need. And a lot of these are products we talked about. The Healthy Habits kit, I added this one in just because it has the vitamins in it. And you can either get it from Canada or the US, and the US kit will have the probiotics in it, which is awesome. And then it comes with a few of the smaller sizes of the oils, which are also awesome for birth and postpartum. And excuse me, and beyond. Like it's we don't just buy these just for this stage of life. We can use them all throughout our life and as our baby grows and as different things come up in our healing journey as well. And then the Family Cura. This is an awesome kit. It gives you the fuller 15 ml bottles, and then the diffuser, which is really awesome to have, especially if there is like some congestion and stuff that comes up. And then just do you want to touch on the Touch kit?
Yes, actually, the Touch collection, I actually call that Mama's Touch on the go, just because it's just so convenient. It's already in a roller bottle. It's already pre-diluted, safe to use and all that, especially during your pregnancy and like babies and all that. You can also dilute a little bit more by adding a little extra fraction of coconut oil when you rub it onto your babies. But this is actually your top 9 essential oils, so it has everything to cover immunity, to digestion, to sleeping, cooling yourself down, like skin irritation, all of that stuff. So and like pain and all that. So this is the one that I was very grateful to have during my pregnancy and beyond. So that is definitely one that I recommend highly for sure.
Mm-hmm. And most of these oils, you're not using like so much of it. Like we're using so little, so they last such a long time. The 15 ml bottles obviously will last longer than the 5 ml. But it's incredible how many bottles I've had for so long, and they are totally fine. They still work, still are functional, and have awesome benefits. And then just some of our other favorite products. So there's a whole section here for kids. So there's that diaper cream, the green, that I was talking about. They also have a baby wash, and then the kids' whole rollerball collection, which is awesome. There are some incredible oils in there, and I use them on my kids daily. This is a great option for babies as well because they are so diluted. So this can be one that you would use for baby, especially the tamer for any kind of tummy troubles that might come up if baby's having a hard time digesting or constipation. And then there's also the kids' vitamins, which as your baby gets older and maybe you're not breastfeeding anymore or giving them any kind of like nutrition support, then these vitamins are really awesome to kind of help get our kids functioning at a really optimal level. And then there's stuff for sleep. So these are the Serenity soft gels that we chatted about and the Vetiver rollerball. So that is a diluted version, which is awesome. There's stuff for reducing toxins within your home. Dishwasher pods, dish soap, laundry pods, an all-purpose spray, and then the On Guard Cleaner Concentrate. And then there's stuff for your hair because postpartum hair loss is a real thing and it sucks. So support your hair naturally. And then for the mind, adaptive, and I added in the whole collection because I think each piece of it is super important for the mind and supporting your body, especially as you go through postpartum, of all the different things that can come up. And then some more products for skin. So getting yourself a really good skincare line can help with any kind of like skin irritations or acne or anything that comes up during pregnancy and beyond. There's the Correct-X we've been chatting about, and then I've added in just some really awesome roller balls that are really helpful for the skin. And lots of other products, the Yarrow Palm we chatted about, the Lip Chop, which is awesome, and the brand new sunscreen, which is really cool once you feel comfortable to put sunscreen on your baby if they're going to be out in the sun for a longer period of time and not have the shade or protection. Getting a really good quality sunscreen is super important for ourselves and for our babies and kids. And then the immune support, there are a ton of On Guard products. These are only just a few, but lots of ways that you can support your immune system. And also cleansing the air in your home. When you diffuse On Guard, you're not only helping our internal bodies, we're actually helping keep the air in our home clean. So there's hand wipes and toothpaste and hand soap and these awesome chewable tabs that can help support the immune system when they're taken daily. So questions, I think I had asked this earlier, but if you're like, I have so many questions, let me know, or you can book a call here in with my calendar link, or send me an email, whichever you prefer. And then the certified lactation consultant, Sam, she is incredible. And so I've linked up her website and her email there. And reach out to her if she's in the Stratford area, if you are local to us. So she does travel a little bit if you're in the local area, but if not, find somebody that you really trust if you're outside of this area, and get them to help you, because we don't need to struggle alone. If breastfeeding is something that really aligns with you and it's something you want to do, don't give up. Keep trying and find somebody that can really help you, because it's possible and it is free and it is a cheap way to give your baby so much nutrition and antibodies and so many things that they need. And then I just got a few of the resources that I used to create this. But again, all of this will be linked up in the email that we have sent you. Stop sharing. Oh, sorry that was so long, but again, you can tell how passionate I am about all of this.
This was really amazing, Chelsea. Thank you so much for sharing your passion and all of this really amazing information. Yes, it's a lot of information, but the good thing is that there's a lot of information, and then everyone can go back into watching and then take some screenshot and then reach out to you, because you are the expert on this subject. And then it's just so amazing that to have you as a support for all of these ladies out there, mama to be and beyond, and all that. So, and I'm sure you linking arms with Samantha, it's gonna make the super team. So I'm super excited for you and then all that is to come. So reach out to Chelsea. She is so amazing at what she does. And thank you for allowing me to be part of this class with you. I'm very honored to be teaching with you.
Thank you, of course. Yes, thank you everyone for joining us or watching the recording. It is awesome that you are here and you want to take that natural approach to this stage of your life, because it's going to open up so many doors for you, which that's totally what happened to me, which is awesome. And you're going to be able to support yourself, your kids, as they grow older. You're going to have these tools within your home, which it's just awesome. Like every time I grab for my oils when my son has fallen and bumped his head and we're grabbing for the helichrysum, it's just like, I am so freaking grateful, because other than putting ice on it, I don't even know what else I would do. Or it's like if there was more of a severe incident, it's just like, I know I can get oils on my kids right away, on myself and my kids right away. It's like getting them on as fast as I can before the next step of treatment or whatever needs to happen. But yeah, these are incredible tools and everyone needs them in their home. But yeah, thank you for joining us, and please reach out if you have any questions. Take care.
Bye.